This is a contrast CT scan of a young patient. I am sharing this case for two reasons. The patient is having pain epigastrium and in right hypochondrium almost for the last 1 month. Now please observe the distended gallbladder and its significant wall enhancement. Now this is the Phrygian cap deformity here. It is very small Phrygian cap and there is a calculus here. While doing ultrasound, there is always a likelihood that we miss such calculi which are lying in the Phrygian caps, and especially if the Phrygian cap is this small. Patients may have acute focal cholecystitis in the region of the Phrygian cap. So one has to be very, very careful in looking at this region of the gallbladder. We must do scans in the longitudinal plane as well as in the transverse scan. And please go beyond the lower margin of the gallbladder. Patient is preferably seen in supine position and in right anterior oblique. That means that the right side of the patient is slightly elevated. Now there is another calculus which is lying here in the region of the neck of the gallbladder. This is the small calculus here. This is the main culprit which has resulted in the acute cholecystitis. Now the adjacent fat planes are normal. Since the patient is having the symptoms and is being treated for the acute cholecystitis, so probably the acute inflammatory episode is now over and the density of adjacent fat is almost normal. So the second point, or the second reason for sharing such a CT is that these are the small calculi in the region of the neck of gallbladder which are likely to be missed if one is casual in doing the ultrasounds. We must dip down in subcostal region or from the right side to look for the neck of the gallbladder once it is distended, because there is always a likelihood of missing such small calculi lying in the region of neck of gallbladder if the patient is obese or patient is thick. So in my humble opinion, if there is acute cholecystitis, there is sludge in the lumen of gallbladder, wall is thickened, perigallbladder edema, lamelation of wall of gallbladder, that is, all the signs and symptoms of acute cholecystitis are there clinically as well as upon the ultrasound. One must always give a guarded opinion that since gallbladder is hugely distended or the patient is very obese, very thick, the possibility of a small calculus in the region of neck of gallbladder cannot be excluded. So it is advisable that the ultrasound is again repeated once the phase of acute cholecystitis is over and the gallbladder has reverted back to its normal. Please observe this calculus here, this one here. So if in a distended gallbladder you do not, and there is a acute cholecystitis and you do not find any calculus or causative lesion, one must give a guarded opinion that it's better to repeat the ultrasound once the gallbladder has reverted back to its normal size and the phase of acute cholecystitis is over.